SJ here from the Rehab Hub. Right now I'm in what's called our semi-private room in the Rehab Hub in Kinning Park in Glasgow. You're on this page possibly because you've clicked, because you maybe have injuries and you're thinking about starting Pilates, specifically Pilates Reformer, possibly as a rehabilitation tool to help you with possibly an injury or pain that you're maybe experiencing, then this is the right page for you. So if you have got an injury and you are looking to possibly have something a wee bit more complex, you've got something going on where you're needing some sort of healthcare intervention, then this is how you get started. Rather than general population where they have got nothing wrong with them, they're fit, healthy, no pain, no issues going on, and they're good to go, then they would normally just book the normal beginners course and get started right away, because we're not having to guide them, assess them, find out what's going on and get the best laid out management plan for them. For you, many clients will use this service because possibly they've got arthritic changes in their knee, they've got knee pain, hip pain, lower back pain, maybe they've got some posture dysfunction, neck pain, shoulder pain, maybe they've had an injury, maybe surgery, hysterectomy, whatever it may be for you. If you've got something a bit more complex, then this is for you. The first thing that would happen is you would be coming in and you would get a full assessment. That would include a posture, full postural screening, and also a human movement biomechanics in an infrared gait lab where you'd be looking at your movement. So that's the first thing that would happen. So you'd be thoroughly assessed to really a research gold standard, and we would be looking at exactly getting you what is going on, what tissues are responding, what's happening, and how we best then help you. The system that we use in here is a system developed at Oxford University, a company called Run 3D or Run Walk 3D, and we actually basically it's like an MRI for your movement. We watch how you're moving, and then from there get an accurate indication of how you're then loading and placing possibly too much stress onto your tissues. So it gives us the best, most precise assessment of exactly what's going on with you, and from there we then have answers and we can then best help you. Because what will happen is that we might think, you might think, I'm really tight or something around my hips, or I'm really stiff around my lower back. Many occasions is that patients will come in and this is maybe what they're thinking, I've got a stiff back. But actually what we then find after we've analysed them and got actual raw data, so we're getting objective data, is that actually that's not the case. There's a weakness somewhere, or this is what you need to be working on. So it's a really insightful and amazing knowledge that it gives you. And what we then do with that is we then help and guide you into what you best need. And that may be that you then can go into almost general population classes eventually. That might not be right for you right away. It might be that you're in this room. So in this room we have, you'll not be able to see over here, but over here we have got 5 reformers with these extra attachments here. These are called half trapeze or towers, depending on what terminology you want to use. And you might be advised that you come into these semi-private sessions, or if you've got something that really is quite complex, then it might be that we're advising that you're doing individual one-to-one sessions, or a combination of both. Every single person is different, and that's the point with this package, is that it's very unique to you, it's what you need, and we would advise from there. But with this package you will get a full analysis, and you will get a starter pack bundle of class credits that will allow you to then use this here. So you're able to come into, whether it be semi-private you use them for, or whether you use that for the bigger type classes, but you get a little bundle of them as well. And you get taken through the same how to use the reformer, the beginners course that the general population would be getting as well, those that don't have any injuries, but a lot more specific to your needs. So we would be going through adaptations, what's right for you, how you maybe lie in a certain position, or what load you're going to put on. So you've got a lot more specificity to your requirements based on your needs. We usually will have you in this semi-private room, certainly if you've got injuries that you're working from. And the great thing about having gone through this assessment is that we then very thoroughly and in depth know your circumstances, your injury, your body. You're not coming into our facility faceless, to a class where we do not know you. We know your body really well by the time you're then coming in and utilising these machines. So as part of this package, you get 2 one-to-one sessions on these machines, as well as that assessment, and as well as a starter pack of the reformer credits that you can use for coming into those sessions once you've gone through the beginners. So if you have pain, injuries, back pain, knee pain, hip pain, whatever that is, or you're maybe just wanting a thorough assessment before you start, maybe you're worried about your posture, maybe you're just worried about getting an injury, or you're trying to just be a bit more proactive, then this is great for you. If you want to take control and get that thorough assessment and get set off in a great management plan where you're utilising the reformer as your rehabilitation tool, then this is where you would start. We'll see you really soon. Thanks for watching.